Good afternoon, everybody. Before we get into the briefing, I surely want to do this. I want to wish everybody a happy Good Friday and a happy Easter in the days ahead. I want to underline again and caution you to worship in your most genuine ways, but try as best you possibly can to not gather in crowds, to keep your social distancing, and I know how important this wonderful, wonderful time of year is, and so I just wish everybody a really happy Easter. We've got several things to cover today. It just continues to amaze me that as things continue to crop up, there's a lot of people that need answers to a lot of different questions. And so one of the questions, and I promised you three things yesterday. I promised you one thing as far as how we were going to address, basically the heroes pay or additional pay for those people that were on our front lines and the people that were our true first line soldiers. And there's a million different ways to go, but the bottom line to the whole thing is it becomes way too complicated if I am saying this person is a qualifier and this person's not. The people that really know the most about what to do there undoubtedly are counties. And so here's what we're going to do. We're going to block grant, all of our counties, each and every one of our counties, $100,000 each in response to this COVID-19. And from the standpoint, then we're going to give the counties an incredible amount of latitude to reward the people that are the true first responders, the people that are the true soldiers right on the front lines. It doesn't matter to me, if they're the people that are at the grocery stores. It doesn't matter to me if they're the public health workers, the first responders, the social service workers. It doesn't matter to me. All that matters to me is this, that you make real judgment. These dollars are not for you to backfill your budget or whatever it may be. These dollars are for you to reward exactly what I've just said. And that is the people that are absolutely looking out for us in every way. And those people need rewarded, and I thank them over and over and over. And this is the best and simplest way that I knew to handle it, and that is to give every county. Now, some of our more wealthier counties, you may very well want to step up and match what we're doing, and some of our counties that are struggling a little bit, this may be a real help. So that's what we're going to do, and I'm really happy to be able to do that and do that today. I'm also going to issue a block grant to our West Virginia National Guard members of $500 per active member for those who are responding to this pandemic, because the work they're doing is just out of this world. That's all there is to it. So I commend all those that are on the front lines. I especially commend our National Guard, and I thank them in every way. And so, that was the first thing that I promised you an answer to. The second thing that I promised you an answer to was Workforce West Virginia, and all the people that were out there still awaiting their unemployment claims to be processed. Now, if you'll just remember, Workforce doing a great job, and they're working it as hard as they can work it, and yet they're not getting it done. And because of the overwhelming amount of claims that are coming in. Now, all of us need to realize just this. Nobody has ever planned for an all-out pandemic. Nobody could have ever possibly planned for that. And Workforce is just incredibly overwhelmed. Now, so if you're looking at the whole process of trying to fit 90,000 of something into a 3,400 something, bottle, it's tough to do. Now, so the standpoint of workforce, what we did right off the get-go was we came right out and said right off the get-go, I said, we're not getting it done. There's no point in trying to turn the fine-tune dial on the TV. The bottom line is we're not getting it done. Whatever we think we need to do from the National Guard standpoint, triple it, General, triple it. And we did, and we did. So we went from one call center to 3, and we made great progress, but we're still not getting it done because it's still an avalanche of claims that are coming in, and our people are working, and they're working 24/7, and we're still not getting it done. So here's what we're going to do. Today we're adding 24 additional staff from DMAPs, including 5 state policemen. We're also hiring 60 additional temporary employees that will start on Monday and will be trained to process claims. So now we're adding another 90 people to process all these claims by next Friday. Now, our Office of Technology is also working on additional software issues to help move this along, and the net of the whole thing is just this. We tripled it one time, we're going to triple it again, and we're going to get these claims processed. And again, I can't possibly thank the people that are sitting out there wondering where their checks are going to come. All your money is going to come, but frankly, to be perfectly honest, it ought to already have been there. And so we're going to stay right on top of it. We're going to get that there. Now I want to jump back to the hero pay, on one of the issue, and that is this. I've told you what we're doing in regard to the counties, $100,000 to each of the counties in a block grant. I've told you what we're doing as far as the National Guard. The other thing that we're doing is I have written a letter, and I don't know where the letter is and everything. I just got through signing the letter. I've written a letter to the president, and basically I am sending it out today requesting that some of the money from the CARES Act go to our emergency responders and other essential workers who are working tirelessly helping us get through this pandemic. So I have written a letter that is going out to the president right now requesting that the president allow us to use some of the CARES money or the CARES Act money and everything to go towards emergency responders and our essential workers. So, they are doing incredible work, and we need to try to backfill and help them in any way we possibly can. So the third thing was the Fairmont Regional Hospital. The Fairmont Regional Medical Center and everything is there. We have looked at it from day one, and what we've done is just this. Immediately, I tried to ask the Guard, to ask the Corps, to ask the federal agencies, and we've done all that to be able to send us equipment to use Fairmont in the case of a surge. Now, for right now, and you'll hear about this later on, we don't have the need today to need Fairmont in case of a surge to put these coronavirus, people all in Fairmont. We don't need Fairmont today. Dr. Clay Marsh will be elaborating on that in just a few minutes, and I'll follow up with him on that. But today, what I want to assure the people of Fairmont is just what we did in the very beginning, and that is this. WVU is moving ahead full steam. They have purchased a tremendous amount of equipment that they're going to be moving into Fairmont Regional in the very near future. There's still equipment that they're waiting on, and absolutely the only thing that has delayed us in all of this that if you'll remember probably now 8 or 10 days ago, the owner, Electo, asked really and truly that there could even be a possibility that Electo could run this for a few more days and everything. And so that in itself has caused a little bit of a snafu. So it's going to push WVU back just a little teeny bit. But I look for us to somewhere in late May or the early days of June to be up and operational at Fairmont, irregardless of any need whatsoever for using that as a surge hospital for this virus. I look at that as a community hospital that we need in our 7th biggest community in the state of West Virginia. So those 3 things I left here with yesterday. I said, you deserve an answer straightforward, because I've had the question twice, and I can't stand to have the question over and over about people that are sitting home and they're waiting on their unemployment checks, and they've got all kinds of issues to deal with, and I don't like it, and I wanted something done about it, and that's what we're going to do. And you asked me about, from the standpoint of processing our unemployment claims, and I've given you that answer, and I've given you the answer on Fairmont. So, also today, we are issuing another executive order in trying to keep up with the possible hotspots across the state. We are adding 4 more counties to this today. We're adding Cabell and Wayne, Wood, and Ohio counties to this. And these areas there's communities within these areas that are jumping up as hotspots. Jackson County did not want us to add them because they feel like they've got a handle on the situation there, and so they did not want to be added to this. But nevertheless, we're going to add those 4 counties, and I think that's going to take us up to 11 counties. And you're going to hear a whole lot more about our curve and everything as we go forward. Let me just see. I've got just a couple other things. I think I can get through them pretty fast. Today we heard from the West Virginia Healthcare Association that they are having trouble getting PPE, protective, equipment and everything for the people that are on the front line there. The DHHR and the National Guard's been all over this, and they've been in contact with the West Virginia Healthcare Association, and we're trying to help them as well. I mean, they're a private organization, and we're trying to help them as well. I want to just read here is if there's any way to help them and take care of them and take care of our seniors, we're going to do that. It's just another little note, but our National Guard and DHHR is on that. Okay, my last thing, my next to the last thing, my last thing I'll do later, but here's something that I want to do. I want to, because I think, especially at this time of year, we want to be very, very thankful. I want to, thank in the most genuine way all of our food volunteers, the people that have pumped out well over 1 million meals, and the people that are doing stuff for our kids, our seniors, and all of us. I want to thank BOAD. I want to thank the BOAD volunteers, all of our food banks, the food bank volunteers, of course, naturally, the Department of Education, Department of Agriculture, and the National Guard for all the work so far. Sometimes we leave out BOAD and BOAD volunteers. We sometimes don't mention our food banks or our food bank volunteers, but thank you. Thank you for all the great work you're doing. And at this time, I do want to now pass on some good news to you. It's really, really important that you understand that, especially myself, your governor, is here to not be crying wolf, to not be trying to scare you, to not be trying to paint a picture that's too rosy, to only be here to be transparent and tell you the truth. We need to be really concerned. There's no question about that. We don't need to drop our guard. But now I'm going to pass the ball to Dr. Clay Marsh, and he's going to give you some news about where we are, where really the surge date ought to be in West Virginia, ought to be. But as West Virginians, just this, that none of us really know. And the great job you've already done. And if you don't keep it up, absolutely none of us will really know. And so, but I can tell you that your good work has led to saving lots and lots and lots of lives. So if Dr. Marsh could come on and talk, maybe he'll give you a whole lot more information and about it than I've got.
Well, thank you, Governor. It's really a privilege as always to be part of this great team, and and the governor is really referring to the updated projection data that we have from the University of Washington, and we are moving very rapidly in an extremely good direction, and that's really to the inspiring work of people in West Virginia, people banding together to protect themselves, to stay at home, to stay physically distanced, to protect their vulnerable neighbors and family members. And by doing this, we are flattening the curve. So the newest data would suggest that our peak is on Easter Sunday, is 2 days from now, that we are now down to needing only 36 ventilators. And the projection, if we continue to do what we do, our number of expected people dying has gone from 500 about a week and a half ago to over 100 to now to 74. So we are really rapidly moving the projection curve in the right direction. But as the governor said, this is just a projection. And we know that every day, with every activity, with every decision, we are writing our story here in West Virginia. So I have 2 data slides I'd like to show. And if we could show the 2 slides on the screen, that'd be great. So this slide is the slide that goes over the information on patients that are COVID positive. And as we saw this slide yesterday, and this is updated today, we notice about 9% of people are in the ICU, about 6% on ventilators, about 17 or 18% of our people are in the hospital, and that's very consistent with the experience that we saw in China. And when we start to look at people at home, about 82%, that is also very consistent with what we've seen around the world. And if we could show the next slide, please. And this slide really does demonstrate how well we are doing because of the good work of you. We look at that we're testing now more than the US average. Our case fatality is down below 1%, which is fantastic given the fact that the US is over 3. And when we look at the people percent positive tested, we are at 3.7 or so. And we see that our percent population based is also very, very good. So we are doing extremely well that way. That's fine, thank you. But I think that with all the good news and we want people to feel good, deservedly so, for the incredible work that you're doing. But as I mentioned yesterday, if we're in a football game, we're about to finish the first quarter, and we should feel really good about the way that we're playing. And I'm sure Coach Neil Brown and the other coaches in the state would be proud of the actions of our citizens. But this is a long game. And what we need to start to do is focus on continuing to be very committed to staying at home as we can, social and physically distancing, protecting ourselves with not putting our hands around our mouth or our nose or our eyes, washing our hands well, because this is making a huge difference. And what we'll start to look for now is we'll start to look for a decrease in the number of positive cases that we're seeing over about a 2-week period. And we know from the information in China that 2 weeks is about the amount of time that we see the duration of the social and physical distancing and staying at home's impact. So now we're going to start to look for that to go down. We certainly, because of your good work, we feel very good about not overwhelming surge capacity at our hospitals and medical centers. And certainly we know that we have excellent healthcare in this state and very, very talented people. And your great work is allowing them to continue to do the work that they do every day, and that you're helping protect them by avoiding this surge. So we are very thankful, particularly during this holiday, for you, for your great work. But we also understand that we still have the same vulnerable population. You know, many people have protected themselves, which means that people don't have immune responsiveness to the COVID virus. So we have bought ourselves more time. We have protected the people that we love. We are waiting for the medications to be developed that treats this disease. We're waiting for the vaccines that will be developed that will protect all of us. And in the meantime, we want to tell people job well done, but we're more at the beginning than we're at the end. And so we really encourage and urge you to continue to do exactly what you're doing now. It's highly effective, it's working, and we want to drop that R sub-zero, the R naught, the infectivity rate from the virus from 5.7, which is what was reported in China, meaning every person can infect up to 5.7 people, to less than 1. Because we know that when we start to come back out again, as Asia has done, that there are still the risks to us of people getting sick, of having the surge come at us in the second phase, not the first phase. And we're seeing in places like Tokyo, they're having problems, Hong Kong having problems, China having problems with that repatriation, with that coming back together. So for us, West Virginia, we are doing phenomenally well. Thank you, thank you, thank you. But don't let up. The game is still at its early phases. Governor, back to you.
Okay, Clay. The only thing I would just add is just this. From yesterday to today, yesterday we were at 3.76, as far as positives per test taken. Today we're at 3.69. We continue to trend the right way. The numbers look good. The trend line looks good. The number of deaths is at 5. That's 5 too many. The number of projected deaths seems to be coming down and down. It's still got to come a long ways down in my book. But at the same time, please, although things are looking somewhat better, and they continue to look better, and West Virginians are doing great work, like I know they always do, and they've listened and they've heeded to exactly the information that we could best give them from our medical community and medical experts. Please just stay the course. If in fact Easter is the surge peak, we're on the downhill slide here. Stay the course, and we're going to run across this finish line, like I said all the time. We're going to run across the finish line together.
All right, thank you, Governor. Next, let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today, 570 National Guard personnel on duty. As the governor mentioned, we continue to surge support to the Workforce West Virginia team to help bring additional capacity there. As he mentioned, additional personnel coming from other agencies in the next couple of days. 3 call centers online taking calls, as well as a 4th center to train the surge of personnel coming in to support. In addition to that, there's beta testing that will start next week for some additional technology to help continue to improve throughput capacity and long-term capability. Want to pay particular tribute to Scott Atkins and the team at Workforce, the Workforce employees doing an incredible job, working an incredible number of hours to make sure that we keep that capability going, as well as training additional personnel. Also want to pay particular tribute to the folks at West Virginia University who provided a surge capacity for us as well in that 3rd call center. In addition, as the governor pointed out, we continue to address PPE issues and continue to support surge capacity at our nursing home and long-term care facilities. Yesterday in Wayne County, 11 National Guard personnel supported some additional testing of 90 individuals. I'll point out that one of the key things that the governor's pressed us on is surge capability with DHHR and our local health partners in these long-term care facilities. If you look at what occurred in Washington State and most recently in the state of Virginia, where in one day period, 32 deaths of the 34 were related to long-term care facilities, it's important to have that surge capacity for the health departments and our DHHR health partners to be able to address those threats. I want to show a couple of pictures when we talk about PPE and innovation and things we're doing to reduce burn rate of PPE. If you could, Jordan, please put up the pictures. If you'll just cycle through those pictures. And these are examples of suits that the governor authorized us early on to purchase to reduce burn rate. They've been used when we provide the surge capacity for the testing, but also today at Eastbrook Nursing Facility in Kanawha County, we provided suits and training. We'll be providing additional suits and training, the Tyvek suits, to facilities that have COVID patients to help reduce the burn rate of PPE and help provide and ensure for greater safety for our workers in those facilities. In addition to that, our teams in the last several days have trained 250 retail outlets and restaurants in additional decontamination and PPE and safety training for employees on the front lines of working those critical jobs of making sure that we can all go to the grocery store, get food from restaurants, and all the things that we need to continue daily life as best we can. In addition to that, the governor mentioned the food bank and VOAD and the food bank personnel and volunteers and the support from the National Guard and others. To date, if you take the support to our children that the governor's directed, as well as our food banks and other support, over 1 million meals provided to West Virginians during this time. Just in the last 24 hours at the food bank in Huntington, 216 family boxes and 316 supplemental food bags, and at Gasaway, 1,813 boxes packed for families in a 24-hour period. Great work by our West Virginia team across agencies, across volunteer groups. Great work continuing to go on. In addition to that, over the past 24 hours, an additional 200 contacts with our team supporting the DHHR and our local health departments in contact tracing. A lot of exceptional work going on across the state of West Virginia. And on behalf of the 6,400 guardsmen, their families, we wish you a great Good Friday, happy Easter, and we appreciate the great work that's going on by West Virginia citizens to keep this curve low and to bust this threat. Thank you.
All right, thank you, General. Up next, let's go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good afternoon, everyone. Had a question yesterday with regard to domestic violence, and I want to make sure we get that information up on the screen today. As we are staying home more, that certainly does not mean that we have to stay in an unsafe home. So in West Virginia, services for victims of domestic violence are essential services. So those services will continue. And they're still available. We're adjusting those services where we need to with regard to using audiovisual or audio services, but they're certainly available to anyone who needs those. We have a slide with numbers and websites coming up on the screen now that you can jot down. Those services include crisis counseling, assisting with resources, emergency shelter, legal advocacy, safety planning, accessing domestic violence protection orders, children's services, and more. To find your local domestic violence program, use these numbers or the website on the screen. Also want to mention the 24/7 national hotline is available. That number, I believe, is up as well. Yes, that number is up as well. So that number is available as well as the hotline.org website. So during this period of social distancing and Governor Justice's stay-at-home order, it's vital that neighbors and family members continue to look after each other. If you suspect any case of abuse or neglect of a child or a vulnerable adult, please report that to 1-800-352-6513. Finally, I just want to thank our many child care agencies throughout the state, our child welfare providers, especially our emergency shelters right now, and our residential care providers. It's a difficult time for everyone. Taking care of our children is a huge responsibility, and we have folks who are stepping up and making sure that our children are safe. Our foster care families and agencies, as Governor Justice mentioned a couple of days ago, we also want to say thank you. We're doing a terrific job out there, and we appreciate what you're doing. I also want to mention we've had a couple of questions with regard to the implementation of child welfare legislation that passed in March, which seems like a long time ago. We are working hard on that, and we'll be giving the legislature updates through conference calls instead of interim committee meetings at this point. So we're working hard on that, as well as all the other services for vulnerable adults that DHHR provides. So thank you all very much for what you're doing. Be safe and take care of your families. Thank you.
And I'd like to first do a shout out to our local health department staff, our state health department staff, who are really actively working with many partners, volunteers, community supports, and our National Guard partners, doing very active case investigation and contact tracing, as well as outbreak investigation related to COVID-19. It is challenging and really important, critical work, and they are doing an enormous job with that. I'm excited to also share that with that information, we use that information to immediately prevent disease in the communities. But then we also use that information to collect data that helps us understand the pandemic more broadly. And so you will shortly, I think, be seeing some additional data from those case investigations that talks a little bit more about what we are seeing. And so we're excited to share that on our website shortly. Folks are doing a great job, as you have heard, in terms of really maintaining that physical distancing, hand washing, all those community mitigation measures that we have really been speaking to and that are really holding things down here so amazingly. There is a new tool, of course, as well I want to talk a little bit about today, and that is the ability to utilize cloth face coverings or other face coverings and face masks. CDC has been recommending now that you can wear cloth face coverings in public settings anywhere that you think that you cannot really maintain that physical distancing piece as well. And so that's a good place to, if you're going to the grocery store or to a pharmacy or anywhere else, we hope you will continue to have that physical distance with that. But if you would like to make sure that you don't think that's always possible, then having a cloth face covering can be very helpful. There's lots of ways to make them. There's lots of guidance on the internet about how to do that. I brought some examples. This is one that actually a staff member's family made for us. They're great. It follows some guidance from the CDC website, and it's made out of cloth and has elastic things that you just put on like that. It's very easy. You can make them out of bandanas. Actually, this one is made out of a bandana and some rubber bands and a little bit of a coffee filter. There's ways to use that, and very easily you can make it in 4 or 5 minutes, actually 2 or 3 minutes. This is one actually made out of paper towels that can actually also provide some protection with that. And really, the goal of these is twofold. The goal is, first, it keeps you from putting your hands to your face or nose, which protects you from that angle. And then we also know that this virus can spread some before we have symptoms. And before we, or even right before we have symptoms, or maybe we never have symptoms, and we can spread this virus slightly. So what having a face covering does is actually allows you to prevent infecting other people. Some we think it actually can block those respiratory droplets a little bit when you cough or sneeze. So that is the thought with that it actually helps us each take another role to protecting other people. So there's lots of information on how to make these on the internet. We'll post some as well, and we'd encourage folks to use those anytime that you feel like that you have the potential of not being able to keep that physical distancing in well-ventilated environments. I think it's important to note 2 things. One is that we don't recommend use of these on children under the age of 2 or on anyone who has significant trouble breathing, because it can be more challenging. You don't want to use it in that setting. But otherwise, for the rest of us, it is helpful and good to do. It is important to know, though, that they do not replace physical distancing and good hand hygiene and environmental sanitation and cleaning. So they can be an adjunct to that. But please continue to do all those other measures that we've been talking about, which you've been doing a great job with and makes a difference long term. Thanks.
All right, thank you both. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Anthony Izaguirre with the AP.
Governor, can you describe what it's been like for West Virginia to find and buy personal protective equipment with all the states competing for the same materials?
Anthony, let me start off, and then I think our general needs to jump in. We have all states, maybe even all countries, have been scrambling with the deficit, in protective equipment and many different layers of it. We have done an amazing job through our Guard and through all the different people that are working it, to be able to secure that type of equipment. And I salute all the work that's been done, because West Virginia, again, the potential highest risk state, had to have the equipment to be able to protect everyone, and everybody was behind. Every single state, everybody was behind. And to get across the finish line, and just imagine, everybody's looking at, New York City is looking at West Virginia saying, well, take everything away from them. Take everything they have. We need it and need it right now and everything. And it would have left us, really holding the bag. But I salute our National Guard and all the people that have really done a lot of good work. Like I said the other day, I got a call from our former Senate President, Jeff Kessler, and he gave me a tip and everything. And off we went. We got 500,000 gowns out of it, and we got 500,000 masks. So that's all in process. But General, if you could jump in and maybe adds a little bit to that.
Yes, sir, Governor. So, Anthony, as the governor pointed out, it is a challenge because it's not just a national issue. It's a worldwide issue with the pandemic being worldwide. We are receiving some supplies from the national stockpile, but they're obviously limited, as the governor points out, because surge capacity going to states that are in much more dire circumstances than we are. We are working a wide number of private suppliers. I don't have the exact numbers of how many folks we've called, but right now we probably have 20 different suppliers attempting to supply us in portions the numbers that we need for the state surge capacity. We've got a team of folks led by some National Guard folks who in their private sector jobs are distribution managers for large corporations who are working to build supply chain as well as forecast models, working with some folks at West Virginia University on forecasting models. And in addition to that, you'll see some things coming out from us next week. Part of the challenge that we were given by the governor was look at innovation. And you'll see some things that we are going to be doing as a state over the next several weeks related to building our own PPE. And you'll see some of those examples coming up next week as we finalize those opportunities. So a wide variety of activities going on. And I think one of the most important things for us going forward will be innovation and West Virginia being able to take care of itself.
All right, thank you, Anthony. Up next, let's go to Amanda Barron with WSAZ.
Amanda Barron from WSAZ. Question for you, Governor, about the 4 counties that you added to the executive order. It's a little more stringent. If we are potentially going to reach our peak on Easter Sunday, are Cabell and Wayne counties taking a turn for the worst? And have all counties been able to turn down being a part of that order like Jackson County chose to today? I know there are people, especially near the aluminum plant, they're concerned right now about that. So just wondering how that process works, if you guys are approaching counties asking them if they want to come online with that, or if it's a state decision, or how that's working.
Well, let me jump in before you go, Clay, and or Bill or Kathy. But let me just say this, from the standpoint of this kind of outbreak in a plant, we did listen to the health officials. We listened to all of our health officials all across all of our counties and everything. But, you know, we're going to make the call as to where the hot spots are and everything. And we're doing that with the medical experts that are rounding up all the information statewide all the time. And so naturally we listen and everything. In that situation, you know, the people there felt very confidently that they were on it and they had it and everything. And so we didn't necessarily need to add them to this hotspot list. But Clay, if you could jump in and maybe add some additional information to the 4 counties we just picked and we designated.
I'm happy to, Governor, and thank you. Amanda, one of the things that we're really trying to do is get ahead of areas where we see a more rapid increased number of positive tests. Jackson was a little bit different because they had had positive tests before we had started to suggest the social distancing, the staying at home, the non-essential businesses, and then with some more focused outbreak in the current group, we worked closely, as we always do, and I'll let Commissioner Slimp make any comments too, but with the local health departments and make sure we are coordinating well. Because these local health departments are really the people that are responsible for those case investigations. And we want to make sure we're working in concert. And we've used a kind of a threshold of the 16 to 20 range of tests, and particularly ones that start to accelerate more recently. That rate of change is important. And on this particular county, we took the advisement of the county health officials and recognized that some of the cases had happened in the past, and the new cases they had pushed them over. But so that one was a much more kind of toss-up question, and the county health officials decided that they thought that they had a good plan and they were doing well. But certainly this is an issue that the governor and we are all monitoring closely, and if things pick up, then we would certainly move forward with the extended executive order. Kathy, do you have anything you want to add?
Sure. I just might say that we always look at any individual county and with those officials. And part of what you can think about is are the cases more related to a particular event or cluster or small network of things, or is there more evidence of community transmission? And so in the areas that we really have offered those or given those orders, the governor's given those orders, there's really been the areas where there's more community-wide transmission. It seems to be ramping up quickly. And so just the numbers alone don't always give you the whole story. So that's really to understand and look behind those numbers and talk to local officials and other kinds of things to really understand what's there. And that's how those get made.
All right, thank you, Amanda. Up next, let's go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was wondering if you could address unemployment benefits for those who are self-employed, independent contractors, and gig workers. Are those folks able to file through Workforce yet? And if not, what's the timeline for addressing that? Thank you.
Okay, I'm gonna make a stab at it, but I'm also looking at you know, my general counsel. But remember when I told you, I think a few days ago, that those rules were coming out next week? They're a little slow to come out on, you know, self-employed or independent contractors and everything. I think they're due out from the feds next Friday, and we're awaiting that, and then we'll pump all that information directly out, and people can solicit that in a lot of different places. But here's what I want to say, and I keep saying the same thing, but people really need to listen and really dial into this from an economic standpoint. There are so many Fed dollars in this stimulus package and everything that can come and help our people in every way and make us whole. And we're working it. We're going to have the information and everything, you know, for the self-employed, the independent contractors. It's coming, and it's going to come, and they really just need to be, you know, prepared and everything to be able to file, and because all of them will be able to be eligible.
All right, thank you. Up next, let's go to Phil Kabler with the Charleston Gazette-Mail.
Good afternoon, everyone. I had a email today from a local physician questioning why tobacco stores and vape shops have been allowed to remain open during the state of emergencies, particularly since there's some indication that smoking contributes to the more serious cases of COVID-19.
Okay, Phil, I can't agree with you more from the standpoint of the tobacco stores. You know, from the standpoint of the bait stores and people being able to get bait to be able to go fishing and everything, and as long as they keep people, you know, at a social distance, you know, when they're receiving or buying their bait, you know, I surely wouldn't want to stand in the way of that. But from the standpoint of the tobacco stores, I very selfishly, you know, lost both my parents to both of them with a very, very, very bad smoking habit and everything, and so I just, you know, I'm only trying to comply with the orders that we put out thus far, but from my standpoint, you know, selfishly, maybe I'd look at it a little bit differently.
All right, thank you, Phil. Up next, let's go to Stephen Allen Adams with Ogden Newspapers.
Yes, Stephen Adams here with Ogden Newspapers. You've talked a little bit about the National Guard and talking about giving them additional pay during this. You've talked about your block grants in regards to counties and helping to be able to provide more money to first responders and essential employees that are obviously working during this. But I'm curious as to whether there's something similar being discussed for employees of DHHR, specifically people that are part of the Bureau of Public Health, who have probably been working this longer than anybody else, and I would imagine working long hours and sleepless nights and things of that nature. Are there any plans to try to help provide some greater benefits or of that nature to help those employees?
First of all, Stephen, I'd like to start off, and maybe, you know, my general counsel could help answer it, but yeah, well, let me just show you this. First of all, this is my letter to the president right here, and you know, I always sign it when I'm wanting him to really see the sincerity behind, you know, what I'm asking for. I always sign it Big Jim Justice and everything, because he always teases me and calls me that. But the second paragraph to this letter reads just this way. It says, I write you today to request that the rules currently being drafted regarding implementation of the CARES Act allow certain of those funds to go to our emergency responders and other essential workers working tirelessly to get through this pandemic. And then over on the next page, going right down the list, you know, it says, I'm looking for additional pay to emergency operations centers. I'm looking for additional pay to health departments and public health workers. I'm looking for additional pay for paramedic and emergency medical services. I'm looking for additional pay to law enforcement and corrections, fire department expenditures, social services, homeless support expenditures, and I don't think have I missed anyone there? Well, there's 10. You know, I'm not going to go. You know, all the frontline workers, and I think, Stephen, I probably caught all the people with DHHR and everything that you're referring to in this letter. Now, I've got to have the flexibility, and the government's been really great in doing this. I've got to have the flexibility to have these funds flow toward. Now keep in mind just this. This right here is what has been committed already to the state of West Virginia, in that there's $1.25 billion minimum that can flow into West Virginia. Now, what I'm asking them to do is allow me to use a certain portion of that money for all these people that you're referring to, Stephen, and that I'm referring to, because these people, along with the Guard and along with all the people, all the different, people from the standpoint of the person that's working at the grocery store aisle checking people out. For all those people that are out there, I'm saying this. First of all, from the county's standpoint, the counties are better to know whom that is than I. So I'm putting $100,000 out to all the counties and let the counties go with it. And the counties should also help their cities, within the counties. Now, so that money goes out to our frontline heroes, okay? The next thing right behind that is the request from the standpoint, well, the next thing right behind that is $500 going to go toward, which is peanuts in the scheme of whole things for what our National Guard is doing to us in a once-in-a-lifetime situation, tenfold this pandemic, $500 going to our National Guard. Now, our National Guard does not qualify for dollars from the CARES Act, but all these other services do, which encompasses almost every single body else and everything. And if President Trump will agree to my language change just a little bit, and they've done this over and over and over to allow us the flexibility to do this, then we'll cover everybody.
All right, thanks. We have time for one more question. We'll go to Kenny Bass with WCHS.
Hi, I wanted to ask the governor about the hero pay and the $100,000 to each county. It sounds great, but when you dig down a little bit on it, say a county like Kanawha County, which has roughly approaching 1,000 first responders, that would work out to $100 a first responder if everybody got something. And they got taxes about $70. And you go to another county, say Calhoun or Wirt or one of the smaller counties, those numbers would be drastically different. So what's the reasoning or the logic going behind the $100,000 amount across the board for each county without making any exceptions for counties like Kanawha and Jefferson and Cabell, who have obviously larger fleets of first responders?
Well, Kenny, we talked about this. We talked about tiering it on different levels by population. It makes a lot of sense and everything, but at the same time, too, a lot of our smaller counties are our poorer counties, too, and maybe they just don't have the resources to be able to help like a bigger county like a Kanawha or wherever it may be. Now, and that's why I call upon the big counties to try to step up and try to help if they have dollars to be able to do so. Now, remember just this. All we're doing here is bridging to federal dollars. Now, and that's all we're trying to do is reward all the great people that have been our frontline soldiers. And I truly, in my heart, felt like that I didn't want to make a stipulation and say, this county is better or bigger than this county over here, and so therefore, I'm going to do a different amount for this county, a different amount. And it's argumentative. I get that wholeheartedly, and it may very well be that you could have done it a lot of different ways. But I will tell you just this, our bigger counties are doing better. They have a better shot to be able to reward and help people. Our smaller counties are struggling in lots of different ways, and we need to help our smaller counties. And the other thing is, it's coming right around the horizon. It's coming where there's going to be a flood of stimulus money come here that we can do lots and lots and lots of good stuff with if we'll just handle it and handle it correctly. And I want to tell you one other thing on our DHHR update. There's a number on your screen if you want if you want on the screen. Let me see. This is our dashboard. And what were you referring to?
Yeah, Governor, it's 5 o'clock. They just put out their final update for the day,
okay.
So the newest numbers are on the screen.
Okay. Well, we haven't jumped any in deaths, but we have jumped a little bit from, we were at 3.76 yesterday. We dropped down to 3.69 earlier this morning, and now we're back up to 3.80. So again, every day it climbs just a little bit and everything. I wish we were absolutely totally flat or going down. And so just stay on guard.
All right, Governor, back to you.
You're back to me? Well, I mean, I was going to read and share some extra thoughts about our letter and everything, but I've already done all that. Again, I just close by wishing everybody a happy Easter and ask them please stay the course. And we've tried to address work getting these unemployment claims out. We've tried to address our hero pay, which these people are extremely deserving. We've given you information on the Fairmont Regional Hospital that it will be running, and a lot of other things like adding additional hotspot counties. And so everybody's working and everybody's working it diligently, but I am a firm believer, don't confuse effort with accomplishment. None of us rest until this is over. And to be perfectly honest, I'm surely one with my wife, Kathy, that wants it over. So let's just hope and pray we'll get there. Thank you so much.